Now, daily, we hear about the current opioid epidemic in Colorado. Dr. Chris Johnston, an emergency medicine doctor practicing at Centura Health St. Anthony North Health Campus, shares what his healthcare organization is doing to address the problem.
This is something we were saying you're very passionate about. It is a crisis, the opioid crisis going on right now. But talk about how this epidemic is affecting where we live, here in Colorado.
Yeah, so nationwide, overdose now is the leading cause of death for individuals under the age of 50. And unfortunately, the epidemic isn't sparing us here in Colorado. So between the years of 2000 and 2014, in Colorado, we've seen an almost 200% increase in opioid-related deaths. Now, the good news is recently, a lot of the numbers and statistics around opioid and the opioid epidemic are heading in the right direction, but the fight is far from over.
Yes, it sounds like it, but it's good to see something's going in the right direction,
yes,
which is wonderful. Now, talk a little bit about what Centura is doing to actually fight back on this as well.
Yeah, so Centura, and this is starting in our emergency departments and is actually now moving into some of the inpatient realm and the inpatient care, but it's based on 4 pillars. So the first pillar is we're looking to decrease the overall amount of opioids that we're using in treating mostly acute pain, non-cancer pain. With that is the second pillar, so that ties into the first in that we're increasing the number of ALTO, and we call alternative to opiates. These are medicines, treatment modalities, some of which are just as successful in treating pain as opiates. The third, some of our emergency departments now are offering medical assisted therapy. So these are medicines like buprenorphine that help curb the cravings of addiction, opioid use disorder, and in concert and support with behavioral health partners that we have in the community, we get them referred and with that can help fight addiction.
Okay.
And then the fourth is our harm reduction strategy. So for example, patients that are at high risk for opioid overdose, we give them Narcan kits so that them or their family can, intervene and save a life in the unfortunate event of an opioid overdose.
So is that something that we as Coloradans can do to help in terms of just being educated on this kind of thing?
Yeah, I think it's that. There's plenty of access to Narcan kits if you want to have one in your glove box or at home. But I think the most important thing that Coloradans can do is really help fight the stigma around opioid use disorder and opioid addiction. It's important to understand that addiction is not a moral failure. It's organ failure of the brain. And in the same way that we approach any organ when it fails, we need to do the same with addiction.
Visit Denver7's Car Care Fair, which is on October 12th, to receive your free car seat safety check. All the details are online, super easy to find, thedenverchannel.com. Just go ahead and search Car Care Fair. St. Anthony North Health Campus paid for today's segment.